I'm a neurologist. I've seen several seizures over my career, and it's a very stressful thing to witness from any loved one or a family member, but in particular, I can certainly recognize that to be true from a child. And they can cause physical injury as well. So a large seizure, with this tonic-clonic activity of all of the muscles, they can cause significant physical injury. With a fall, of course, if you're falling off at any sort of elevation, there can be dislocations of shoulders. I've had a few times with patients from seizures. I've had patients who've gone into atrial fibrillation or irregular heart rates from their seizures. So even though we certainly do a very good job of controlling these seizures, this is one of the reasons why, is because we're trying to minimize physical injury. And when someone has a seizure, the muscles that are involved in breathing are muscles that are contracting with the generalized seizure. And so we worry about aspiration or something going down the wrong way into the lungs, which can set up something like a pneumonia, which can be of concern as well. And then when they don't stop, or if they cluster together frequently, they can lead to difficulty with breathing. Similarly with the aspiration, if you can't control which way your saliva or something is going, those are similar muscles that help you affect your breathing. And so sometimes people need to be put on ventilators or assisted with their breathing in case a seizure doesn't stop on its own. This is not something where you will swallow your tongue. I think that's a common myth associated with seizures. Don't worry about having anybody swallow their tongue. And seizures are more concerning when they last longer than 2 minutes. As I stated before, most seizures end within 2 minutes. And so the longer it goes on, the longer it's likely to go on. So we want to be sure that we're trying to use treatments to keep them shorter. If they're repetitive, and this is certainly true with children, there can be difficulty with cognition and also common comorbidities with mood alterations. And then, of course, it's a very stressful experience and the anxiety of having another one of these episodes.